Welcome, 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 welcome. I want to welcome everyone. We are on our fourth chapter. This is episode 4. We're going to have a telling fourth today. I've had great conversations with Shara, and she has just told me so many other things. And I think it's important to share with all of us. And if you don't know who I am Grant McGaugh. I'm CEO of Five Star BDM and host of the award winning Follow Brand podcast and TV series. And I am here with the renowned author S. Lewis Campbell, and she's sharing with us through Global Voices a mini series on Black women, specifically around her health in the world that we're living on a worldwide level. And we're having this unified global voice discussion. So I first like you to introduce yourself, Shara, and then we're going to jump right into our conversation.
Well, thank you very much for having me, Grant. I really appreciate it and being able to sort of share my story or globally, as it were. I am Shara Lewis-Campbell. My pen name is S. Lewis-Campbell. I'm the proud author of around 16 books. I do stop counting very early, but if I go back and do the math, it's around there, that figure. And I'm also publisher authors, especially new authors as well from underprivileged backgrounds.
Excellent, excellent. And you reside in London, England, which I just love when I think about that. A lot of people, they fantasize and they look around London to see how it is. You've lived there, I guess, your entire life, but you've got roots in other places, even over here in the Western Hemisphere, in the Caribbean island, things like that. But you've had certain experiences, specifically in the national healthcare system, NHS, where you spent nearly a decade there. And from what you've seen firsthand, and I want to ask you this very candidly, what do we often get wrong about how healthcare systems actually work behind the scenes from your experience?
I think the biggest issues that we have is translating what often looks really great on paper, in terms of like patient care, and actually translating that down on the ground. I mean, the two is quite a contrast and quite a stark one at that. Having been a patient, especially for someone who hardly ever used the service to someone who is using it quite often at the moment or has done earlier this year. I've seen that there has been very little change. If anything, it's probably gotten a lot worse, I think, in the past 3 decades when I've had to rely on the service quite heavily myself and also been part of the service as well in terms of the delivery of patient care. And in the work that I have done, especially at board level, the biggest concentration that we have is delivering great patient care, maintaining standards and improving standards even. And as well as that, making sure that we have a unified and a positive experience for the patient, and ensuring that we're improving patient health care. And from what I can see, a lot of the time we are working with people within the system that are either tired, very overtired, underpaid, maybe even fearful of their own positions, unsure even, and it can be quite a negative experience. And I feel that within itself is in part responsible for some of the poor care health conditions that we're seeing today.
This is important because this is what I'm hearing, and it's not just our past 3 episodes, but from the many people that I've interviewed in the healthcare system on all sides, where they're in the patient side, they're in the provider side, they're in the payer side. Now, you've spoken very highly of your own health journey because it's very personal. And I think when people think about healthcare, they would agree that it's a very personal experience. You're very vulnerable at the time. You're not really sure, or you may know what you're going through, but you don't know how this is really going to affect you over time. Now, you included in your journey that you had early menopause and also a full hysterectomy just at an early age of 34. I want to know if you could share with the audience How did that experience shape the way you now view women's health and advocacy?
I think it's definitely changed my opinion, in terms of the healthcare that I received, especially being like a female who's very severely unwell. And it took such a long time, it took a year and a half to even diagnose me. And with only 3 consultations during that period, because there was nobody suitable to do the work. And how I even got in that state was because of a previous um, uh, procedure that I had had, which was a general one, but wasn't administered to me generally. So I had a lot of complications that sort of materialized over time, which then arose to me having to have that for his to me, unfortunately. So this is something that could have been prevented at the time had I had the right advice, had the right professionals been in place, and had I had the right care given to me at the time. So for most of that, I was self-administering, my own care, figuring out what was working for me, what wasn't. And to be honest with you, a lot of the time, I felt failed by the healthcare system. And unfortunately, I wasn't working in it at that time. So I didn't have like a bunch of specialist advice available to me. It was like any other general patient. But what it has taught me is that I have to take my own healthcare in hand. I cannot rely on what the specialist says. I'm grateful for the advice that they're able to give, because it sort of gives me somewhere to start, with my own research and what methods of healthcare is probably best for me.
This is so important. You just brought up something, and I did a little research, and it said it takes 7 to 12 years for a woman with endometriosis to receive the correct diagnosis. You talked about self care. You're doing this yourself because a lot of times it's dismissed as normal. Obviously, you're talking about hysterectomy, other things that aren't normally done at that time and age. It's important to understand, what's happening. I'm wondering, are we just taking some of these things to be, routine and not understanding there's a lot of nuances there in that world? How do you feel about that when you found out some of these statistics around the things that you went through and say, wow, am I outside the norm, or is this norm? Is this how care is to be administered?
I think there is a huge importance, that when you think about the developing countries or the advanced countries that we live in, where we're supposed to be sort of like on top of the latest medical advancements and technologies, I still don't quite understand why it is that the levels of mortality rates for uh, Black females has not changed, within our respective countries. What is being done about that? Now, to me, when I look at the healthcare system, I think that one of the reasons for that is because of the level of importance or priority, that is given to us, in terms of the subject matter, then, as it were, and also in terms of the funding that's available. Now, we've spoken in the past about where we don't even feature. Last week, we spoke about not even featuring in the AI statistics and not
Mhm.
even having a voice there. So therefore, that funding is not going to be available, for the types of treatment that we so desperately need. And when you think about it as well, even in comparison, again, just touching briefly on the conversation we had last week about the AI statistics, when you compare the mortality rates to the same categories of our female white counterparts, they are vastly improved because the technology is aimed and geared and the funding is there for them. And I'm sure that there is also some personal bias as well in terms of how these treatments or how the funding is administered as well. But it's very important that Black females are not put off by this. If you don't raise, your voice and realize that you have a strong community around you that are also having to do the same, and you're not alone in this, that's the only way we are going to see change.
I totally agree with that wholeheartedly. You've got to amplify your voice Otherwise, you will not be heard. You don't want to be silent about these things that could save your life. Now, one of your passions is life-saving education, and that's from first aid to home-based care that we've seen, it's on the rise for a lot of different
Mhm.
reasons. Maybe because what you're referring to is like if you're not feeling you're getting 100% of the care that you need from your traditional healthcare systems, whether it's clinical or in a hospital setting or uh, uh, assisted living facilities and things of that nature, people are starting to do certain things from home. I want to understand from your lens, from your experience, why do you think this knowledge is still missing from mainstream health conversations, and how or what can we do to change that?
I think my only sort of like response to that, why there is so little education being offered, why I'm not seeing more of it on like, our visual screens, seeing more of that. To me, it should be mandatory. It should be compulsory that we're getting that information. Like I said, have said in previous conversations, we see lots of things, lots of medication, placebos, you name it, being offered, on mainstream TV, and being sold to us, for various causes, depression, you name it, HRT, all different types of medications and treatments that are available. There's very little homeopathic remedies being, advertised in this way, there are, it's not mainstream, definitely not. And I think that my only response to that, I would say, is because it's being gate kept, by the fortunate few then, who have access to that information. And when you consider that most illnesses or accidents happen at home, rather than in the hospital, or they happen in the workplace, or even seldomly, why is that information not available to us? Surely, by having access to that information, it would bring about change in quite a significant way, in that we would see sort of like, our waiting lists decrease, quite significantly. People had access to that information, at least be in a position where you can kind of think and help yourself to some degree before even reaching out then to the emergency services. But little of us, very few of us have that information, unless you have a personal interest, or it forms part of maybe your employment then, where they do administer some life-saving techniques. It's not something that's given to all, and it should be something that should be part of the equitable healthcare that we receive.
You know what I found out, especially in my travels to the Virgin Islands, the U.S. Virgin Islands, St. Croix, they do use a lot of what you call homeopathic um, um, or at-home health. I would put it like that, and how they admit, and they believe in it. It's not just, oh, by the way, that's just some secondary way of healing yourself. This is the primary way of healing yourself, and they use a lot of natural ingredients in what they do, and they have found it to be very effective. Now, I'll go back to, I come from this world of branding and marketing, things like that. Know, like, and trust is very, very important. So you may know about your healthcare system. Do you like it? Do you trust it? And if you can't handle or kind of mark all three of those off, know, like, and trust, it's going to be a problem. And what you're saying, you got to self-educate yourself. If it's
Yeah,
not part of your cultural world, that type of thing, and to get a better understanding of what is available to you, this is important. Now, you yourself, you've had multiple family medical emergencies, from your daughter's near, she almost lost a limb, to your father's 4-year coma, which is pretty traumatic. What did those moments reveal about what's missing in care systems today?
exactly that. The things that are missing, the huge gaps, especially in terms of advice, patient care, support for the families. As you can imagine, in terms of the coma experience with my dad, I think that, you know, I couldn't even imagine a more traumatic time for a family to go through. And you can imagine the the impact that has had, in terms of maybe people not seeing eye to eye in terms of the treatment. We needed to be able to sort of come together. And it starts as well, not just with the families, but also with the medical advice that you're given. How can you make sound decisions if you don't have the education? So it really sort of brought that home to me in terms of my daughter and the experiences that she went through. I mean, there is a serious lack of communications between the local emergency services and the national services. I think greater emphasis needs to be given and training in that area. And I think especially for the local emergency services as well, it'd be very interesting to see, because of amount of the amount of times that they are very quick without having the guidance or all the information, that they are not willing to send out emergency help. It'd be interesting to see the mortality rates during that, maybe on a yearly cycle, to see what the impacts of that has been, because it'd be interesting to see, because I think if I hadn't have been in the position where I had a district nurse here who was here visually to see the plight that we were in and overrid that decision, that would have been something I wouldn't have been able to do. So then it wouldn't have been a case of, oh, my daughter was unwell and didn't receive treatment. It would have been, oh, my daughter was unwell, didn't receive treatment, and she's lost a limb. So now this is now escalated into something else. And the potential impact to my family had we not had to do diligence. And I just don't think that kind of service is acceptable. And I must also say as well, this series for me isn't about sort of exposing the cracks and not having solutions. It is about everybody taking sort of accountability for their part in this. I do feel that there has been occasions where it's about just the patient has just expected the doctors to come up with all the answers, and I don't think that is the way forward. We need to be a lot more involved in our healthcare, and I think that's something that I can see has changed quite formidably within the UK, and I think within the US it's already there because of the fact that it is a sort of paid service. I'm not sure that sometimes it leads to the best decisions, because when you live in a society whereby you can become bankrupt in your own business, or decide on having medical treatment, if that's always going to be the choice that's going to be made, the mortality rates you can expect to sort of increase quite dramatically. So I do think that there's sort of like some give and take, but there is definitely cause for improvement. And in terms of homeopathic remedies, I can say this, and I stand on it, it saved my life. Had it not been for the due diligence of my business partner, who saw that I was failing miserably, in terms of my health and the vertigo, and he was the person that went away and found that solution for me, and it was something that I already had in my home. I tell you now, had it not been for that, I know that I'd still be struggling with that condition. So I'm really grateful to him, for finding the
I'm
cure,
grateful
and
to
it
him
saved my life.
as well, because what we found, and we're going to see in our next episode 5, we're going to bring a subject matter expert in clinical trials, understanding that certain medications were specifically made for certain groups, and they behave differently in different people, and I don't think we all understand it. And case in point, like seafood. You might love seafood. I love seafood. But you give seafood to someone who's allergic to it, they're going to have a massive reaction. Well, there's a lot of
That's me.
micro reactions. There you go.
Mhm.
So it could affect. It doesn't affect everybody the exact same way, and we
Mhm.
start making those types of choices that we feel like all medication is made for all people. That's a bad
Mhm.
assumption to make. And I know there's a lot of, like you talking about, healthcare workers themselves. There's real burnout. There's some bullying. There's mismanagement. There's things
Mhm.
happen. But what you said about accountability is so important. In my own world,
Mhm.
when my own father's tragic, demise, I thought it was a failed total system, not because the providers made a mistake. They actually didn't. but from the payer standpoint, they couldn't figure out who's paying for what. And then from the patient standpoint, we didn't know exactly what was going on. So you're completely like not understanding what's at stake,
Yeah.
and what's happening. Someone that just had a mere broken leg, but if it sits for a very long time, it can develop a clot. And that clot, because
Mhm.
in my father's case, had one lung, that it just
Mhm.
traveled to him and then shut him down. But if I was aware of that, I
Yeah.
would say, hey, you guys, somebody, you're going to get paid. Doesn't matter. Just
Mhm.
do
Sort
the
it. Yeah.
just do it,
Mhm.
figure that stuff out
Yeah.
later. But to your point earlier, if you're not aware, you're not taking accountability, someone is not standing up
Mhm.
for what is right and what's to take be necessary about this. And I like how you frame it. We're not blaming one part and good, bad, and like that. It's like this is a system problem, and that we're
Mhm.
all part of that. If we can become more aware of it and say, hey, there's a lot of things that we can do to heal ourselves. I remember, because I'm old enough now, acupuncture. I remember acupuncture.
Mhm.
People like, but it wasn't, you could never get reimbursed for it.
Mhm.
However, it then became a part of the payer system. So you know what, we'll reimburse for this type of thing. I remember the chiropractor. Oh, we're not paying for that, but now
Mhm.
they do. So
You
these
do.
things that we call like outliers and homeopathic and all this other stuff, you think it's like it's less than, but it really isn't. You're just not, it's not part of the system for it to be reimbursable, like telehealth, right? Telehealth
Yeah.
wasn't being reimbursed at that same level. So there's enough that we can become aware of, that we can think
Mhm.
about. But this is what has caught my attention now, and that's women's health, and that um, I just did not know that there were so many other exposed problems that are out there that are specific to women, specific to Black women, especially when it comes to pain management or pain
Mhm.
threshold, that you're living in this condition, and then you're not being diagnosed correctly, and then you're having to either self-diagnose that you've done to prevent that. I would like to know more about that. Like, what's your big vision? What do you think or hope for every woman that's watching this can walk away with?
I think there needs to be a greater understanding. It's not just about one size fits all, I mean, if you really want to tap in and do some great work on behalf of, the female, sex then, as it were, within healthcare, greater emphasis needs to be understood about our makeup to begin with. We're all very different, half of us don't even know where we came from when we think about our own genetics, something we were discussing after the program last week, so I think that a lot more funding needs to be available, and we need to have more of us speak up, so that we can get the treatment that we need, because we know that our systems are very complex and we have a different makeup from each other, never mind races outside of our own. So, I think that needs to change. There needs to be greater advocacy as well, and there just needs to be just more improvement, greater delivery of care as well, accessibility to it. And we need to just, I think in the end, I would just like to see one universal, equitable healthcare system for all of us, on a global scale. I want to be able to come to your country, should I get sick, and be able to receive the same standard of healthcare that anybody there would expect to receive, and vice versa.
That would be ideal to have. There's just so much within the system itself that has nothing to do with direct care.
Mhm.
You brought up some of that in the pharmaceutical world. Everyone has an agenda of one type or
Mhm.
another. I always look at follow the money. You have to follow the incentives. Most of the time, that's going to create behaviors. And then
Yeah.
those behaviors are then who's accountable for those behaviors. Usually it comes down to policy. It comes down to how things are done. Are they holistic in nature, or are they just specific in nature? And again, if your goal is to basically turn a profit, let's just say, in most healthcare systems, that's not really the goal, especially in a hospital system. But when you start looking at others, and I'm going to point a finger over at the pharmaceutical world, because they make incredible amount of money,
I
and,
do.
and it taxes the entire system. And
Mhm.
I think it does it at a level that's not um, ethical when
That's
you
right.
really
And
think
it's
about it.
politically driven. Yeah,
Yeah,
it's politically driven as well, as we've seen, with various uh, global instances quite recently in terms of COVID, and so forth, where particular medical companies were preferenced over others, and it all turned out to be just a big money-making exercise. We need to see less of that, and because I do
100%.
think there is a huge issue between bureaucracy, and just personal gain, rather than what the focus should be on, and that is genuine healthcare, to people that deserve it.
If you don't mind, help us understand this. You've been on the other side of the ball at the health system. Decisions are being made. You're at the table, and then you see this incredible spike in expensive for pharmaceutical care. Let's just point that one out. How does that conversation usually go?
Well, to be honest with you, it's just said and just accepted, because these decisions have already been made. And, just like what I referenced to you before, you know, um, these are they're almost like backdoor deals, as it were. They're just presented and they're not always agreed with, but sometimes too much money has been spent on it, just like we've seen with various projects, that are brought in, or incentives or brainwaves. Sometimes we can see that, they're bringing in new advanced technologies, and sometimes we can see how those technologies are performed, and over a period of time we might see that they're used for sort of ongoing practices. But very rarely do these things transpire into anything. It doesn't even go that route. Usually they've just, done a testing of it, they've spent all this money. The results weren't exactly what they wanted them to be. And that was the end of that, until the next project, or incentive comes along, or pharmaceutical company, that's been able to sort of pitch well. And it's just not acceptable anymore. I mean, in this way, patients are being treated like guinea pigs, and it's at the expense of lives. We've seen when these trials, have not gone accordingly, and the impacts that it's had in changing those people that, opted, to put themselves through that, to be quite fair. So, I mean, I think at the end of the day, there needs to just be a general. You just need to have the right people in the position that want to reach the same goal, which is to improve healthcare for all.
I'm glad you're talking because in the U.S. we have a for-profit system. That's exactly what it is. We're trying to turn
Mhm.
it to a fee for service system. You kind of live in both of those world with the national health system that's government, but everybody pays into it. It's not
Mm,
really free. And they
no.
all have certain services available, but then you also see people getting outside of that because they don't feel or they think they get better care because so they have a socioeconomic standard. And then it comes like that. Is it like that? And I know we only got about a minute left, but is it really like that in London, where if you're using the NHH in the National Health System, NHS,
Yeah.
is
Yes.
less
Yeah.
than the paid system?
Hmm. It does appear to be that way, especially in terms of like waiting lists and things of that nature. So if you're paying for it, you can get a if you have the money and you're privileged to be able to go that route, and you want private care, it's a matter of hours, days, minutes, even, depending on the type of treatment that you need. However, if you are going through the system that you've paid into, that's supposed to be free, and don't get me wrong, the price of the treatment that you're receiving is quite astronomical. But I'm sure with the amount that you're paying out each year, you are definitely, covering some expenses of you could even say like quite an array of even basic operations for other people to receive. So you're definitely covering costs in in some way or another. And I do feel that that care with it leaves a lot to be desired at times. I know that some people have received really good care through it, and I know that that is definitely the intention, but that is not often the case, especially when you've got epidemic viruses and things like that. Queues will be out the door, the whole system's chaotic. You'll be hard pressed to find a hospital that is available to treat you there and then. The minimum wait for they say for treatment at accident and emergency is 4 hours. And that's 4 hours from the moment that you arrive. You'll sit at these systems now that have been kind of upgraded and can they're AI intelligent, so they can tell you exactly how the wait is. And you'll be quite surprised how quickly 4 hours can go to 7, depending on, what else is coming in to be treated. You're sort of going up and down the list, depending on how serious your illness is.
This is important information. I want to thank you again for sharing your experiences with us so we can have a voice around Her Health Global Voices. This is what it's all about, telling women's health stories. Next week, or actually August 1st, we will have a subject matter expert in the world of clinical trials. And we'll be talking to Shar about that, because this is very important when it comes to drug development, precision medicine, things of this nature, and why we've got to have a voice in the room. Otherwise, you could be left out of the equation. So I want to thank you again for being on the show.